If you are alone and feel a crushing weight on your chest, the clock is your greatest enemy. Calling 911 is first step, but the average ambulance is still 8 to 12 minutes away. In that gap, your heart muscle is dying. You might think swallowing an aspirin is the answer. It's not. Swallowing takes 40 minutes to work. We are going to show you a chemical bypass technique that hits your bloodstream in 5. A study published in the American Journal of Emergency Medicine analyzed cardiac events and found that patients who took specific strategic actions before paramedics arrived increased their survival probability by doubles or triples. We are cutting through the noise to give you a combat-tested protocol, 6 specific steps that increase your survival probability. Let's get to work. Protocol number 6. The logistics. We are starting with logistics because if the medics can't get to you, imagine you have successfully called 911, the ambulance is screaming down your street. The paramedics are ready, but when they arrive, they hit a wall, a locked front door. A review of emergency response logs in major metropolitan areas showed that forced entry delays, the time it takes for fire or police to break down a door, add an average of 4 to 7 minutes to patient contact time. In the world of cardiology, 4 minutes is an eternity. 4 minutes is the difference between a stunned heart and a scarred heart. This brings us to the Lighthouse Strategy. The very first moment you feel that crushing weight, before your legs give out, you must unlock your front door. Do not just unlock it, crack it open. If you have a screen door, prop it open with a shoe, a book, or a chair. Why is this priority number 1? Because gravity is your enemy. As your heart struggles to pump, your blood pressure will drop. If you pass out, you will likely be on the floor. You will not be able to stand up to answer the doorbell. If the door is locked, paramedics have to wait for the fire department to arrive with a halogen bar to pry it open. That noise, that chaos, and that delay is time you do not have. But we are taking this a step further. You need to make your home say emergency. Turn on the porch light. Turn on every single light in the living room and the hallway. You need to distinguish your home from the 10 other houses on the block. Ambulance crews are trained to scan for the brightest house on the street. It acts as a visual target that allows them to find you without checking house numbers in the dark. If you live in a secure apartment complex, this is trickier. Call 911, then immediately call a neighbor or the building manager to meet the ambulance at the lobby. Do not let a security gate be the reason help fails. Protocol 5. Aspirin. You have likely heard take an aspirin, but the nuance of how you take it is where the survival advantage lies. To understand this, you have to understand the enemy. A heart attack is essentially a plumbing disaster. A plaque deposit in your artery has ruptured, and your body, trying to heal it, has rushed blood cells called platelets to the scene. These platelets act like sticky Velcro. They clump together, forming a dam that completely blocks the flow of oxygen, to your heart muscle. You need to dissolve that Velcro immediately. A clinical trial conducted at the University of Texas Southwestern Medical Center compared absorption rates of aspirin and found a massive discrepancy based on ingestion method. Swallowing a pill whole is like waiting for an ice cube to melt in a cold room. It is slow. It takes about 20 to 40 minutes for a swallowed pill to travel down your esophagus, dissolve in stomach acid, and enter your bloodstream. In a cardiac event, you do not have 40 minutes. Your heart muscle begins to die permanently after 20 minutes of oxygen deprivation. You need to perform a chemical bypass. You must chew the aspirin. By chewing a standard 325 milligrams non-coated aspirin or 481 milligram baby aspirins, you are breaking it into microparticles. More importantly, you are allowing the medication to mix with your saliva and absorb directly through the mucous membranes in your mouth and throat. Researchers found that chewed aspirin inhibits platelets, the sticky cells causing the clot, in as little as 5 minutes. Swallowed aspirin took nearly 3 times as long to achieve the same effect. The texture will be chalky and the taste will be bitter. It will be unpleasant. Do not worry about the taste. Chew it into a fine paste and swallow it. Unless you have a known severe allergy to aspirin, This 325 milligrams dose is the single most effective chemical intervention you can perform on yourself. Protocol 4, nitroglycerin. This is the point most people miss, and it is the one you specifically need to understand if you have been prescribed it or have access to it. This is the nitroglycerin protocol. While aspirin stops the clot from getting bigger, nitroglycerin works on the pipes themselves. Think of your arteries as a highway. The clot is a car crash blocking all the lanes. Aspirin stops more cars from piling up, but nitroglycerin actually widens the highway, adding extra lanes so blood can squeeze around the accident. Nitroglycerin is a potent vasodilator. It relaxes the smooth muscles in your blood vessel walls, opening them up to reduce the workload on the heart and improve blood flow. But there is a strict protocol for using it safely. A study in the Journal of American College of Cardiology highlighted that improper use can actually cause blood pressure to bottom out, leading to fainting. Here is the 3-step nitro rule. First, the seat. Never take nitroglycerin standing up. It drops your blood pressure rapidly. If you are standing, you will faint, fall, and hit your head. Sit down immediately before taking it. Second, the placement. Do not swallow it. Place 1 tablet or 1 spray under your tongue. The area under your tongue is rich in capillaries. This allows the drug to hit your bloodstream in seconds. If you swallow it, the stomach acid destroys it. You should feel a slight burning or tingling sensation under your tongue. If you don't feel that tingle, your medication might be expired. Third, the 5-minute loop. Wait exactly 5 minutes. If the pain is still there, take a second dose. Wait another 5 minutes. If pain persists, take a third. Do not exceed 3 doses. If 3 doses haven't stopped the pain, the blockage is severe and you need that ambulance immediately. Critical warning. This is life or death. If you have taken any erectile dysfunction medication, like Viagra, Cialis, or Levitra, within the last 24 to 48 hours, do not take nitroglycerin. The combination of these 2 drugs causes a catastrophic drop in blood pressure that is often fatal. This is not a joke. It is a chemical incompatibility. If you are on these meds, stick to the aspirin and wait for the paramedics. Next, protocol number 3 is posture. Once the chemistry is in your system, you must alter the physics of your blood flow. When people feel weak or dizzy, their instinct is to lie flat on the floor or the bed. This is a potentially fatal mistake. When you lie flat, gravity spreads your blood volume equally across your body. This sounds good, but during a heart attack, it floods your chest cavity with volume. This increases what cardiologists call preload, the pressure stretching the heart chambers. Imagine your heart is a pump that is currently struggling to do its job. If you lie flat, gravity makes it easier for blood to return to the heart, but it makes it much harder for a damaged heart to push that blood back out. This creates a traffic jam in your chest called preload. By sitting up, you use gravity to keep some of that blood volume in your lower body, giving your heart a much-needed break. Most importantly, sitting up allows your lungs to expand fully, ensuring you get the most oxygen possible while the pump is under repair. You need to reduce the workload on the pump. We use a technique called the W position. The action plan. Sit on the floor. Do not sit on a chair, because if you faint, you will fall. Sit on the floor and lean your back against a wall, a sofa, or a sturdy bed frame so your torso is at a 45-degree angle. Now, this is the crucial part. Bend your knees up and keep your feet flat on the floor. Your legs should form a W shape with your body. Why this specific shape? First, it utilizes gravity to pool some blood in your legs, slightly reducing the amount returning to the heart. This lowers the stress on the heart muscle. Second, and equally important, it allows your diaphragm to drop. When you lie flat, your stomach and liver press up against your lungs, making it hard to breathe. By sitting up, you open the chest cavity, allowing for maximum oxygen intake with minimum effort. A study from a European respiratory journal monitored oxygen saturation in patients with respiratory distress and found that those in this semi-seated position maintained significantly higher oxygen levels than those who lay supine. Protocol 2. Breathing. Now that you are positioned correctly, we have to talk about the panic loop. When the chest pain hits, your brain's amygdala triggers a fight or flight response. You start taking short, rapid, shallow breaths. This is hyperventilation. Here's the problem. Hyperventilation constricts your blood vessels. At the exact moment your heart is starving for oxygen, your panic is narrowing the roads that deliver it. You are accidentally strangling your own heart. You must manually override your nervous system. You need to engage the parasympathetic brake. We rely on a technique rooted in biology involving the vagus nerve. The vagus nerve runs from your brainstem down to your abdomen and acts as a direct brake pedal for your heart rate. You can stimulate this nerve through a specific breathing pattern. The action plan. Forget the paper bag. That is for anxiety, not a heart attack. Instead, focus on the exhalation. Inhale slowly through your nose for a count of 4 seconds. Focus on expanding your belly, not your shoulders. Hold that breath for 2 seconds. Exhale forcefully through pursed lips, like you are blowing through a very thin straw for a count of 8 seconds. The ratio is key. The exhalation must be longer than the inhalation. When you extend your exhale against the resistance of your lips, you create positive pressure in your lungs. This pressure stimulates the vagus nerve, releasing acetylcholine, a chemical that tells your heart to slow down and relax. Let's look at a case involving a 62-year-old teacher in Oregon. While experiencing chest pain alone, she remembered a yoga technique involving rhythmic breathing. By the time paramedics arrived, her heart rate was elevated but stable, and her blood pressure had not spiked to critical levels. The emergency physicians noted that her ability to remain calm and regulate her breathing likely prevented the clot from fully obstructing the artery during those crucial waiting minutes. Protocol number 1, the data tattoo. This final tip is the extra survival hack that almost no one talks about. It is the golden variable. There is a class of drugs called thrombolytics, often nicknamed clot busters. These are powerful medications that can dissolve the clot in your heart and restore blood flow instantly, potentially preventing any permanent damage. However, they come with a serious risk of bleeding. Because of this risk, doctors are bound by a strict FDA-approved time window. They can generally only administer these drugs if the symptoms started within a specific number of hours. If you arrive at the hospital confused, drifting in and out of consciousness, and cannot tell them when the pain started, they may be legally and ethically unable to give you this life-saving medication. You need to record the time of onset. We have armed you with the science. We have given you the protocols. Now, it is up to you to keep this knowledge accessible. If you found value in this life-saving breakdown, please leave a like on the video. Not for the algorithm, but because liking it helps share this information with other seniors who might be alone right now. And I have a question for you. Do you know your exact family history of heart disease? Tell me in the comments below. It is a conversation we need to have. Stay prepared, stay calm, and stay alive. We'll see you in the next video.